Hi, Dr. Shakib here from Irvine Spine and Wellness Center. I am here with Ian, and I'm just demonstrating what an adjustment for Ian is like. Ian does have some specific issues, so every time he comes in, we focus on those areas, but those are not the only areas that we go to. The whole spine and ankles get looked at. And just to let you know, there's more than one way to get adjusted. This is a diversified technique that I use. Some people, it's contraindicated, meaning they have conditions that they really shouldn't be adjusted this way, at which point I'll adjust them a different way, similar to more than one way to go to your home, as long as you get home. So in this case, I'm going to show you what an adjustment in the office for Ian is like. So I'll first palpate, and right here, Ian, is the part that we've been seeing over and over. That seems to be chronically misaligned. Can you take a nice deep breath in, all the way out? This is the area in Ian that kind of the spine gets dipped in, which is very unnatural for the movement of that area. And I want to make sure that you guys pay close attention. When you get tired, don't be doing that. Or when you get tired, don't lean back against your chair if the top of your chair ends here, because it forces the vertebra to go in the movement or have a movement in the direction that it's able to do, but it is not natural for it to do. So be aware of that. So these are the types of things that when I adjust the patient that have to do with potential lifestyle, that I raise it to their attention, and at the end of the day, it's educating the patients that really is the focus. Take a nice deep breath in, all the way out. Very good. That didn't want to go. Now, Ian, what's your input on the amount of force? Am I pushing it hard or what?
Not at all.
Okay, that's the key. Pushing, it's not a fight. This side of you. It's not a fight. It's very gentle, just the minimum amount of pressure to get the segment moving. And if the area is too tight, I'm not going to force that adjustment. It needs to be addressed. So as I'm doing this, I can see that Ian's leg wants to go in that direction. I already know your IT band is tight. I already know that in Ian's case, he's gonna have to go home with some homework with foam rolling for the IT band to kind of undo this. But the most important part is, why is it tight to begin with? That is my role. It's easy to mechanically do certain things, but you have to understand what you're doing that's causing the problem, right? Come forward. It could be a lifestyle, it could be a modification determined by the brain, posturally speaking, that is making this muscle get tight and overworked. Nice and relax it. Relax it. Face the other way. And we're going to do the same thing. This side is not as bad. So on the other side, I know his lower back was engaged too. Why? Because the very first time when I went to deliver the thrust and adjust the area, it didn't want to let go. Come forward. Nice and relax. All the way. One more. On your back. So Ian, when you get adjusted, what's your favorite part of your adjustment?
Honestly, it's getting my neck cracked.
I know it.
It's the best feeling ever.
Bend your knees. Now, Maddie, you want to stand over here? Because I'm going to turn that way. Nice and relaxed. That was good. So at this point, I'm gonna grab the neck and simply pull. What I'm looking for is if his mid-back muscles, which are, there's a muscle that goes all the way to the neck, if they're going to let go evenly, and I can feel, yeah, go ahead and lift this side up. Right here, it's pulling back. So I'm symmetrically moving the neck, but this side muscles in the back are not letting go as much. Go ahead and sit up. Once again, it could be that that's the site of injury. He's right-handed. All of those play a role. So, and obviously when it comes to doing stuff outside, exercise-wise, for the brain and the body part, at this point with Ian, we're working on getting him started with some of the homework to do at home. Right there, Ian.
Yep.
Go ahead and bring this here. Go forward. Nope. That way. And back. Again. And back. Again. And back. Bring your elbow down. All the way down. Go ahead and push against my finger here. And relax. Again. That's a good one, isn't it? Relax. Again. Relax. So the point here on Ian is I just noticed that some of the muscles around his scapula, shoulder blade, are a little bit tighter. So I'm going to give him some certain things he can do on his own, on the stretching part, and on working on the trigger points. When he is to come back here, we're going to incorporate it, working on that either myself with active release technique or with my massage therapist, whichever works best as far as what Ian's needs are. Bottom line, you know you're going to love it, right?
Every single time.
Thank you so much for watching. The next video is going to show you some of the things we do in the bigger room with regards to the DNS, dynamic neuromuscular stabilization, and we're going to start in on some of the exercises that are related for the brain weakness parts and posture, brain-based neurology and postural exercises. Thanks for watching. Take care.